Good morning. My name is Dr. Barry Goldstein, and I've been a clinical nutritionist and a chiropractor for over 23 years. And clinical nutrition is the ability to treat the body using whole food vitamins. How do I accomplish this? The body senses energy changes, without a question. Externally, you could be in cold water. It'll say it's cold. It'll shunt all the blood into your major organs. Senses. By the way, cold is a form of energy. We all know that. We just don't think of it that way. You're in a room where the ceiling is low. You don't have to look up. You feel compressed. You really do. You sense it. It feels weird. You are in a room and your back is turned and light comes through. You know there's more. So you could have your eyes closed. You'll know there's more heat, energy. Energy, sun is a form of heat. It senses it inside your body too. That's your nervous system. So we kind of tap into that. And I use your body using muscle testing. And it's a really simple technique. And I'd like to demonstrate and kind of show you guys what I do. Kelly, if you can come up. And I'm just going to take a muscle. It's really simple. And I'm just going to tell her to lock it. By the way, you can put this down. This is a muscle response test. It is not the strength of a muscle. We're not looking to hang on your arm. As soon as it gets a little mushy, it tells me something. You should be able to lock to about 3 to 5 pounds of pressure. Anybody. I don't care who you are. Okay? And I'll just touch the body as I go through it and touch. These are all brain reflexes. And this all stays strong. And I'm doing like a screening now on her. And this is where your pineal reflexes and your pituitary, and both of them, they are hypothalamus. And some will make sense to you in a moment. This is for master sinus. Close your eyes, Kelly. And this is for your eyes, your sinuses. Another maxillary sinus one, open. This is for your jaw. This is for your lower jaw. I'll touch the ears. These are your glands. These are pretty obvious. Thyroid. This is what we call the mediastinum, and it's a lung reflex. These are lung reflexes. I'm going to have her touch over her left breast, and this is a heart. You'll touch where the bile duct is, where the liver is. It's over the organ. This is where your gallbladder is. This is where your stomach is. This is where your pancreas is. This is where your spleen is. Now, I'm not really touching hard, but it went down on spleen. And then I'll touch the small intestines up. And this is where the large ascending. This is the transverse, called descending sigmoid, call it. On women, uterus down here. And her bladder is next. And it goes down on bladder. I don't have to push hard. And over here, a little personal, these are where the ovaries are. I'm going to touch her kidney in the back. Everybody knows the kidney's here. I'm going to touch the adrenals. I'm going to touch the other, elbow straight, and the other one. So far there's only 2 things. What would I address? Maybe both of them. It's hard. I'm going to now think about taking care of her bladder. I have probably 20 different things for bladder. I'm just going to go into just some simple testing today and look at her bladder and look at different remedies. And this is carbamide powder. You say, that's not a vitamin. It doesn't make anything stronger. It makes it weak. Your body tells me everything. This is something called Alboplex. It's, again, these are whole food vitamins, locked. Now, that makes it strong. I'm just trying to show you that she is an easy nutrition case. These may be one of the things I would use for her. It tells me that it's a strengthening tool. It will help her body. These are very designed programs, I would say. They're like a tailor-made suit. They're very specific for your needs. 2 people walk in with exactly the same symptoms, and they'll walk out with completely different programs.